Oh, we're keeping a close eye on the hotspot areas around the country with regards to COVID-19, especially those areas where tourists are going to flock to. Of course, one of those is KwaZulu-Natal. That's the COVID-19 epicentre at the moment. Just over 4,000 cases recorded in the last 24 hours. So how safe are people feeling? How ready is the Department of Health feeling in KZN? Always good to have Dr. Sandile Tshabalala with us. Dr. Tshabalala, morning to you. So numbers are up. Tourist numbers are up as well. How is the department feeling in trying to keep the numbers at a manageable level ahead of Christmas and New Year's?
Good morning to yourself and good morning to the viewers of your program. Look, you are speaking of the last 24 hours, but we can tell you that from the 15th at least, we were seeing more than 5,000 new cases on a daily basis. On the 15th, 16th, 17th, then we saw 4,000, as you are saying, and that is a worry on our side. We think the contributing factors to all that is the, of course, behavior of the very community that was serving, in terms of them using the masks and all the non-pharmaceutical interventions. But also we're thinking that people who are working outside the province are coming back with whatever behavior. Thirdly, the people who are, as you are mentioning, coming for holiday, that also may contribute. You will remember that at some stage we closed the Rage, which also was showing very high numbers. So we're worried about that, and we are encouraging people to take care of themselves in the form of non-pharmaceutical interventions. Let them test, let them be admitted if they need to be admitted after testing positive, but also let them be responsible in all the activities that they are doing, and let them work with the government in terms of making sure that we reduce the speed at which the Omicron or any variant is spreading.
Let's talk a little bit about the numbers that we're going to see primarily on the beaches. Dr. Tshabalala, we know Christmas Day, Boxing Day, we know New Year's Day is always going to be very busy as well. You mentioned the closing down of Rage because of the number of people in one area on a beach. But now, come those 3 days I just mentioned, we're going to have tens of thousands of people on the beach. How are you seeing that as a different type of event, and how concerned are you about the number of people on the beach for Christmas and New Year's?
Look, the Premier of the province of KwaZulu-Natal, like the President of the country, like all the MECs in the province have always been preaching to people that it's not only the function of government to take responsibility, it's all of us who must take responsibility and make sure that we adhere to this. But on top of that, the issue of enforcement of some of the requirements or some of the behaviors is one of the things that have been spoken about. It's not an easy thing because some people, you've just been speaking about behaviors on the road after people have been, they've taken a few shots. I heard even Khemer there. But look, at the end of the day, it can't be government alone. All that the government is asking is that let people partner with government, let people take responsibility while government is readying itself for any of the eventualities. Let people work with government in the process. That's all that we want to preach. And also, people must vaccinate. Our vaccination levels are not where we wanted them to be. And if people are vaccinated and for one way or another find themselves getting to be infected with COVID-19, we expect them not to be sick such that they are symptomatic and they therefore may not need to be admitted. And when we have to admit high numbers of COVID and high numbers of violence, trauma, or accidents, the strain on the healthcare worker is going to be too much.
Why not, Doctor, as a final question to you, why not, especially over this time of year and the numbers we are seeing, as you're saying you want to try and keep the numbers down, take the strain off of healthcare workers and hospitals, why not limit the number of people on the main beaches? Surely there's a way of enforcing that. I know you can't monitor every piece of beach along the KZN coast, but at the big beaches, surely there's a way of handling those numbers and limiting those numbers?
I think, Gareth, it's important for us to first thank the healthcare workers for the work that they are doing. But secondly, it's important for us to appreciate that a lockdown, we are not in a federal country, and therefore a lockdown only in the province of KwaZulu-Natal will have a certain meaning in terms of the ruling and the running of the country. That's the first part. The second part is that even if you lock people down, we have seen during other lockdowns situations where there is increase in terms of gender-based violence and other traumas and violence. So the lockdown does not only impact people negatively, it also impacts on the economy itself. Do you want them to experience that, or you want people to be responsible just like government is responsible and work with the government? I think that's what we want rather to do, rather than people being locked down and then having to experience other traumas in the process.
Well, I appreciate your time. It's a very good point you make, Dr. Sandile Tshabalala. I think many people are going to agree with you on that. All the very best for the busy few days ahead for you and your department. The head of KZN Health joining us here on the South African Morning. It's heading up